Good afternoon. My name is Reesee and I'm excited to be with you today. I look forward to taking your thoughts and questions at the end of this presentation. I want to inform you about 3 aspects of rickets. Rickets is a disease or a condition in children where there is a defect in the mineralization and calcification in immature bones from lack of vitamin D that causes the bones to break and fracture easily. These details are its various symptoms and deformities, its specific etiology, and its diagnosis and treatment. As you can see in the visual, there's a distinct difference between normal anatomy and rickets in children. With the normal anatomy bones, you can see that the sides on the insides of the bones are thicker, but with rickets, they tend to loosen and thin, and they also cause pressure in certain areas that causes it to crack and fracture. The first aspect about rickets that must be addressed is its symptoms. Some of the signs and symptoms include growth delays or growth retardation, muscle weaknesses, skeletal deformities, hypocalcemia, which is low calcium in the body, tetany, which are muscle spasms that are caused by hypocalcemia, seizures and pain in the bones, especially in the pelvis, spine, and legs. The next aspect is the etiology or causes of rickets. Rickets can develop in children if they have disorders of vitamin D, calcium, or phosphorus, and if they have a deficiency in calcium. However, the main cause of rickets revolves around a vitamin D deficiency. It plays a significant role in the prevention of the disease. With vitamin D, it is responsible for maintaining the calcium and phosphorus homeostasis within the body. And vitamin D is derived from sunlight exposure, from supplements, fortified foods, and like fish intake. The last aspect is diagnosis and treatment of this condition. So rickets can be diagnosed by blood labs, so drawing blood and sending it off. You can also do x-rays and physical examinations, so that way they can see like both legs or anything like that. They can see like the physical aspects of the condition. Or there's an alkaline phosphatase testing. ALP is an enzyme made within the bones, the liver, the intestines, and the kidneys, and that ALP level shows a vitamin D deficiency. There are many treatments for rickets. The main one that is used to treat rickets is the vitamin D and calcium supplements, because usually the cases aren't that severe. If they are a little more severe, then they may have to brace the children as they grow so that their bones and like their skull, or not their skull, their spine grow properly. If it's bad enough or if it's caught too late, surgery may be required for the severe deformities. These are just a couple examples of children with rickets. You can see their bows, like their legs are bowed, and this of course prevents them from being able to walk and to just live everyday normal life. I would also like to emphasize a few points in conclusion. These 2 would be the causes and treatments of rickets. It is mainly caused by a vitamin D deficiency, and it can be treated and prevented by taking vitamin D supplements and calcium. But this is really important for people to know because there's also an adult version of rickets. It's called osteomalacia, and this is due to the bone softening due to vitamin D and calcium deficiency. So, I mean, if you go out in the sun or do anything like that, the vitamin D from the sun should be enough to prevent this from happening, but it still happens. And thank you for your time, and I look forward to taking your questions and thoughts now.